Congratulations on receiving your eVive rehabilitation system with SciMotion technology. The eVive system is designed for use with and without a postoperative brace. Your physician will determine which eVive configuration is right for you. For instructions on how to use the brace and set the range of motion controls, please visit www.scimedicaortho.com to download detailed printed instructions for use on eVive, including how to use the postoperative brace. Throughout your rehabilitation, you will apply the garment for daily muscle activation sessions to comfortably and conveniently strengthen your thigh muscles. To begin using your eVive system, you must have paired your eVive controller with your mobile, smartphone, or tablet device before it is inserted into the eVive conductive garment. Ensure your controller is turned on. Then open the eVive app and complete the simple, detailed app setup process. Follow the on-screen instructions to pair your mobile device with your controller. Now that you have paired your eVive controller to your smartphone, you can begin using your eVive system by snapping the controller into the cradle on the garment. It is very important that you first place the hydrogel electrodes provided to you in the correctly designated orientation on your garment before beginning a stimulation treatment. Your garment is provided with pre-installed electrode wires that have a protective cap covering the metal conductive pins. After acquiring the provided electrode set, remove the plastic electrode pin covers and discard. There are 3 electrodes within your eVive garment system. Plug the small square 2" by 2" electrode and the 2 other rectangle 2" by 4" electrodes into the metal pins until completely covered. After electrodes are attached, push electrode wire back into garment as far as possible. Position the electrodes, black Velcro side down, within the garment outlines. For more detailed information on electrode placement and information on replacing electrodes, please refer to the printed instructions for use provided with your eVive system, or visit www.scimedicaortho.com/support. Once the eVive controller has been docked and the electrodes have been placed, you can position the garment on your injured leg. The garment is positioned and applied by sitting with the injured leg extended, either on the floor, bed, or chair. Place the garment underneath your leg, with the round hole positioned directly behind your knee and the blue surface on the inside of your thigh. To secure the garment, wrap the blue electrode panel on the inside of your leg around the top of your thigh. Tighten the outer garment flaps, beginning with the flap just above your knee. Pull flap tight and firmly attach to the garment panel. Continue securing each garment flap. For best fit, secure each garment flap in the order shown, beginning with the flaps closest to the knee, then proceeding outwards. The garment should be comfortable and snug against your leg. Retighten panels as needed. Now that you have your garment secured properly to your leg, you are ready to use your eVive system. Press the Begin button to go to your main home screen. This eVive app home screen allows you to view your rehabilitation results, perform electrical stimulation for muscle strengthening, as well as test your range of motion. The top section of the eVive app home screen will display your daily progress. Each day you will be asked to conduct 3 20-minute stimulation muscle strengthening sessions and 1 range of motion test. To start a stimulation session, simply press Session 1, 2, or 3 icon as demonstrated. To test range of motion, press the ROM icon. The middle section of the eVive app home screen will allow you to view the history of your muscle stimulation sessions, pain levels, activity steps, and range of motion progress. Press Stimulation History to view your muscle stimulation session details. Press Range of Motion History to view range of motion results. Similarly, you can do the same for pain and steps. This important dashboard will help you track your progress to your rehabilitation goals. The menu bar at the bottom of the eVive app will appear on most of your screens. This menu bar was designed to allow you convenient access to the most used features of your eVive application. It's important to remember that the home icon on this menu bar will always take you back to this home screen. You may also use the icons on the bottom menu to start a muscle stimulation treatment session, perform a range of motion test, or view items in the menu, such as settings, profile, goals, and other help functions. Congratulations! You are now ready to complete a muscle stimulation session. The power of the eVive system with SiMotion technology lies in its ability to comfortably stimulate and strengthen your weakened thigh muscles. We call it SiMotion Muscle Activation Technology. To achieve optimal results, it is recommended to perform muscle activation sessions 3 times a day for 20 minutes, 6 days per week. Sessions should be performed daily throughout your rehab protocol. When you are ready to begin your 20-minute muscle activation therapy session, remove the electrode covers from the garment, exposing the sticky hydrogel surface of the electrode. The electrode should be clean, undamaged, and tacky enough to stick to your skin. For best results, apply a pea-size amount of electrode gel to your skin where the electrodes will rest. The electrode gel helps transmit the muscle activation signal between electrode and your muscle, minimizing signal dissipation and discomfort. Position the garment under your leg, ensuring proper alignment of the electrodes to your thigh muscles. Secure the garment flaps by pulling the electrode panel over your thigh and tightening the flaps. From the dashboard screen, you can press the top Daily Stimulation Session logo or the Stimulation Session logo from the bottom menu bar. Press the Get Started button when you are ready. Once daily, you will be prompted to rate your current level of pain. Simply slide the circle with your finger to the appropriate level of pain and then press Start Stimulation. Your eVive app will display a screen asking you to select your stimulation treatment type. 2 types of treatments are displayed: post-op and strength. Select the treatment prescribed by your doctor. Often, post-op is used in the weeks immediately after surgery, reawakening your atrophied muscles. Strength is then used throughout your rehab program to strengthen your thigh muscles without stressing the healing tissues in your knee. Once you have selected your treatment type, you will then set the stimulation intensity for your knee and thigh areas. The colored dot on the garment picture is the zone controlled by the same colored control gauge. While the eVive is adjusting many of the stimulation factors to ensure a more comfortable experience, you have ultimate control over the intensity of the stimulation level. Intensity can range from a setting of 0 to 100. The higher the intensity value, the more powerful the stimulation signal sent to your muscles to trigger the therapeutic muscle contraction, effectively exercising your muscles. To set the intensity level, press the plus button to increase intensity until a strong but comfortable muscle contraction is achieved. While the sensation of muscle activation may be unusual, it should not be painful or very uncomfortable. Many describe it as a mild tingling or buzzing feeling. If the intensity is too strong, press the minus button until a more comfortable contraction is achieved. Repeat this process for both the knee and thigh muscle areas. Note that it is common to have different intensity levels for both the knee and thigh muscle areas. Additionally, as your body changes, your intensity levels may differ between muscle activation sessions, even in the same day. Set the intensity that is most appropriate for each session. Having selected a strong but comfortable intensity for both muscle groups, press the Start Treatment button to begin your 20-minute treatment session. The treatment screen will display the remaining time as well as allow you to change the intensity levels for either muscle area. Depending on the treatment type, the eVive will alternate between periods of activation and periods of rest. At any time, you may press the red pause button at the bottom of the app to interrupt the treatment program. Press the orange play icon triangle to resume the app when ready to restart your treatment session. You may terminate your therapy session at any time by pressing the orange Stop X icon on the screen. Alternatively, you may press the power button on the eVive controller at any time during a stimulation session to pause the stimulation. Pressing the button again will resume the session. You can press and hold the controller power button for a few seconds to shut down the system. At the end of your 20-minute session, the stimulation session will automatically stop. You will be prompted again to rate your level of pain and the comfort of the stimulation therapy. Remove the garment from your leg by unstrapping the flaps. Reapply the provided electrode covers in order to maximize the life of the electrode and improve your activation comfort. In addition to electrical stimulation, the eVive system incorporates range of motion sensing technology. The range of motion test is easy to perform, and will allow you and your healthcare provider to track your rehabilitation progress against your goals. Once daily, you will be prompted to perform a range of motion test. To begin the range of motion test, first be seated at the edge of the seat in a chair where your knee can extend and bend comfortably. It is important that the garment be adequately secured to your leg as described in previous videos. For accurate range of motion readings, it is important that the blue stitching on the top of the thigh area on the garment be aligned with the middle of your thigh. Similarly, the blue stitching on the bottom area of the garment below the knee should be aligned with the center of your shin. Adjust the garment as needed for proper orientation. After pressing the pink Start Test button, slowly extend and flex your leg to the extents that you can achieve. It is important to not overexert your range of motion beyond your comfort limits and to follow any instructions that your doctor may have provided to you. The knee image on the app will show the angle of your knee. Once the limits accurately reflect the range of motion that you feel you can achieve, hit the Capture button. That's it, you're done. If the readings don't seem accurate, you can always reset the values by selecting Reset or Test Again. By pressing the pink Done button, you can return to the home screen where you can view all of your daily, weekly, and monthly range of motion results. This completes the overview of the eVive Rehabilitation System's usage. We trust that you enjoy your experience with eVive as you seek to take control of your rehabilitation.